Hello and welcome. Today, we're diving into a common yet often misunderstood heart condition, stable angina. We'll explore what it is, why it happens, and how it's managed, providing you with a comprehensive overview to better understand this condition. Stable angina is typically caused by atherosclerosis, a gradual buildup of plaque inside the coronary arteries. This plaque, composed of cholesterol, fat, and other substances, narrows the arteries, reducing blood flow to the heart muscle. The risk factors for atherosclerosis are the same as for other forms of heart disease, including high cholesterol, high blood pressure, smoking, diabetes, obesity, a sedentary lifestyle, and a family history of heart disease. Now, let's break down the pathophysiology. When the coronary arteries are narrowed by plaque, the heart muscle doesn't receive enough oxygen-rich blood, especially during physical exertion or emotional stress. This oxygen deficit, known as ischemia, triggers chest pain, the hallmark of angina. In stable angina, this pain is predictable. It occurs with similar levels of exertion and is relieved by rest or medication, such as nitroglycerin. Stable angina is a relatively common condition, affecting millions of people worldwide. Its prevalence increases with age, and it's more common in men than in women, although this difference tends to narrow after menopause. The exact numbers vary depending on the population studied, but it represents a significant health burden in developed countries due to lifestyle factors and an aging population. The primary symptom of stable angina is chest pain or discomfort. This pain is often described as squeezing pressure, heaviness, or tightness in the chest. It typically occurs during physical activity, emotional stress, or exposure to cold weather and is relieved by rest or nitroglycerin within a few minutes. The pain may also radiate to the left arm, shoulder, neck, jaw, or back. Some individuals might experience shortness of breath, fatigue, or nausea along with the chest pain. Diagnosing stable angina involves a combination of medical history, physical examination, and diagnostic tests. An electrocardiogram or ECG can detect abnormalities in heart rhythm and electrical activity. An exercise stress test, where you walk on a treadmill or cycle while being monitored, can help identify ischemia during exertion. In some cases, imaging tests like echocardiograms or coronary angiograms, also known as cardiac catheterization, are performed to visualize the coronary arteries and assess the severity of blockages. Stable angina doesn't have distinct types in the same way as some other conditions, but it is classified based on the frequency, severity, and predictability of symptoms. The Canadian Cardiovascular Society Angina Grading Scale is often used, ranging from Class I angina only with strenuous activity to Class IV angina at rest. This classification helps guide treatment decisions. The goals of treatment and management are to relieve symptoms, prevent progression of the disease, and reduce the risk of heart attack and death. Lifestyle modifications are crucial, including quitting smoking, eating a heart-healthy diet, maintaining a healthy weight, and engaging in regular physical activity. Medications commonly used include nitroglycerin for immediate relief of angina, beta blockers and calcium channel blockers to reduce heart rate and blood pressure, and antiplatelet drugs like aspirin to prevent blood clots. In some cases, procedures like angioplasty with stenting or coronary artery bypass grafting (CBG) may be necessary to improve blood flow to the heart. Preventing stable angina involves adopting a heart-healthy lifestyle. This includes maintaining a healthy weight, eating a balanced diet low in saturated and trans fats, cholesterol, and sodium, exercising regularly, managing stress, and avoiding smoking. Controlling other risk factors, such as high blood pressure, high cholesterol, and diabetes, is also essential. Regular check-ups with your doctor can help identify and manage these risk factors early. The prognosis for stable angina varies depending on the severity of the disease and the presence of other medical conditions. With proper management, many people with stable angina can lead active and fulfilling lives. However, stable angina is a chronic condition that requires ongoing management and monitoring. Recent research focuses on developing more effective medications and minimally invasive procedures to improve blood flow and reduce the risk of future cardiac events. Gene therapy and stem cell therapies are also being explored as potential future treatments to regenerate damaged heart tissue and improve coronary artery function.